So an example, we've been fortunate that we've been able to run some pilot programs through our organization at the college, and we've been exploring innovative ways to expand the role of the pharmacist and to look at sustainable business models. And so if you look at a pharmacist that's coming from the community setting into that role, what we've done in our pilots is to embed the pharmacist directly into the primary care setting in a patient-centered medical home. One of our pilots, our second one, which was in a rural town of Lancaster, South Carolina, we recruited a pharmacist to come work in that environment. And the pharmacist we actually recruited came from a retail setting. They were a community pharmacist. Her name is Carrie Hatcher. And so what I think is unique that I'm excited about is that Carrie had no residency training. She had experience in the retail setting, but she didn't even really have that much experience with much direct patient care because she was in a chain that didn't allow her to do that. However, Carrie had all the skills that you would possibly want to have to go over into that AmCare setting. So she had great clinical knowledge. She had worked hard to keep her skills up to date. She had good communication skills. She could build rapport with the physicians. She could build rapport with the patients. And so that combination has allowed her to be successful in that transition. And I think if pharmacists, particularly in the community setting, are looking for that opportunity, many of them may not have residency training and they may not feel like that they have the ability to do it. I think there are resources that can help them fill in where they do feel like they have weaknesses. But it is possible, it is feasible, and in some cases, especially if they're in the more rural areas, they may be the only provider. So if they don't do it, then I'm not sure who else will.